Are your cold feet more than just poor weather? What about always feeling exhausted or having issues down there for the gents? Well, today we're diving deep into 6 signs of poor blood flow or circulation. These are signals your body sends when the vital transport system is in trouble. Think of it as your body's SOS call, urging you to pay attention before things get worse. So if you've been ignoring these subtle cues, it's time to listen up. Poor blood flow isn't just an inconvenience. It's a potential red flag for serious health concerns, and the earlier you spot the warning signs, the better equipped you'll be to take action. From lifestyle tweaks to medical interventions, understanding these signs is the first step towards better health and well-being. Now, before we dive into these signs, remember this video is for informational purposes only. Please consult a healthcare provider for any medical advice, diagnosis, or treatment. Got it? Get it good. Let's begin. Sign number 1, cold hands and feet. Imagine this. You're all bundled up, but your fingers and toes still feel like ice cubes. You might shrug it off as just being you, but persistent coldness could signal poor blood flow. When the circulation isn't optimal, your extremities like fingers and toes can feel icy because they're not getting enough warm blood from your heart. This happens because your body's focusing its warm blood supply on vital organs, leaving the extremities feeling chilly. It's like a VIP system where the important parts get first-class treatment and the rest of the areas have to wait. But why is this happening? Well, several factors can be at play. Imagine your arteries as roads for blood flow. If those roads are narrowed by plaque buildup, like in atherosclerosis, it's a one-way street for the blood flow. Plus, certain conditions like Raynaud's syndrome can make your blood vessels spasm, restricting blood flow. Now, while feeling cold here and there might not be a big deal, consistently chilly hands and feet could be hinting at something more serious like vascular disease. So if you're constantly battling the cold, even in cozy environments, it might be time to talk to your doctor. They'll likely ask about your lifestyle, run some tests, and create a plan tailored just for you. This might include simple changes like regular exercise and a balanced diet. Or if there's a more complex issue, they might suggest medication or other therapies. Remember, while a bit of coldness might be just you, persistently icy extremities could be a sign that your body's trying to tell you something important. Sign number 2, numbness or tingling in your extremities. Picture this. You're reaching for that can of Diet Coke and suddenly your hand feels like an alien has landed. It's not your Coke craving. It's a sign of poor blood flow. When blood flow is less than stellar, your extremities like hands and feet can experience numbness or tingling sensations. It's like a biological SOS call where your body is saying, "Hey, I need more circulation around here." This happens because the reduced blood flow means less oxygen and nutrients for those crucial nerve cells. So what does this mean for you? Well, it could be a signal that your arteries are getting blocked or constricted. Think of it like a traffic jam for your blood flow. Conditions like peripheral artery disease or vascular dementia can cause these blockages. Now, while this might sound alarming, especially when you're craving that can of Coke, it's essential to take these signs seriously. Prolonged numbness and tingling aren't just annoying. They can indicate a severe condition called peripheral neuropathy. This can lead to permanent nerve damage if left unchecked. So if you're constantly battling numbness or tingling, don't just push through it. Instead, schedule a chat with your doctor. They'll assess your symptoms and recommend the necessary tests. It might involve a simple ankle brachial index test where blood pressure readings are compared between your ankle and arm. Based on the results, your doctor will tailor a plan to improve your blood flow and overall health. This might include lifestyle changes like a balanced diet and regular exercise or medications to manage underlying conditions. Remember, while a bit of numbness might seem like a minor annoyance, persistent tingling or loss of sensation is your body's way of signaling a more significant issue. Sign number 3, fatigue or lack of energy. Feeling drained all the time. Imagine you're in the middle of that intense game of Candy Crush, but instead of virtual lives, it's your energy levels dropping like the stock market. Yep, We're talking about that persistent feeling of exhaustion that seems to follow you everywhere. While fatigue can be a result of a hard day's work or an all-nighter spent binge-watching your favorite series, constant fatigue could be a sign of poor blood flow. Think about it. If your blood isn't circulating efficiently, your body isn't getting the oxygen and nutrient-packed fuel it needs to function optimally. It's like trying to run a marathon on an empty stomach. You might start off strong, but eventually you'll hit the wall. Similarly, poor circulation can leave you feeling weak and utterly drained. What's behind this circulatory roadblock? Well, several culprits could be at play. Atherosclerosis, with its artery-narrowing plaque buildup, can hamper blood flow, leaving you feeling sluggish. On the other hand, conditions like congestive heart failure can make your heart less efficient at pumping blood, resulting in that perpetual feeling of tiredness. Now, while a little fatigue might be part of your busy life's hustle and bustle, persistent exhaustion is your body's way of waving a red flag. It's telling you that something's amiss with your circulation. So if you're constantly feeling fatigued and your to-do list is looking emptier than usual, it might be time to visit your doctor. They'll ask about your symptoms, delve into your medical history, and recommend the right tests. This could include a simple check of your blood pressure or a more in-depth cardiac evaluation. Based on the findings, your doctor will craft a plan that suits you, which might encompass lifestyle modifications like a balanced diet and regular exercise or medical interventions to address underlying issues. Remember, while some fatigue is part of daily living, persistent exhaustion is a signal that your body's vital circulation system needs attention. Sign number 4, swelling in your lower limbs. Picture this. You're wearing your favorite pair of jeans, but lately they seem to fit a bit tighter around the ankles and calves. Or maybe you notice that your feet seem a tad puffier than usual. If you're experiencing persistent swelling in your lower limbs, it's not just a quirky character in a B-grade horror movie. It could be your body flashing a yellow light for poor blood flow. Here's the deal. When blood isn't circulating as smoothly as it should, fluids can start pooling in the tissues of your lower legs and feet. This happens because your body's natural drainage system gets overloaded when the blood isn't flowing optimally. Now, while a little bit of swelling might be a product of standing all day or a salty snack, consistent puffiness is your body's way of saying, hey, our circulation system needs some TLC. This swelling, also known as edema, can be a symptom of various circulatory issues. For instance, chronic venous insufficiency makes it tougher for blood to return from your legs, making them feel heavier than usual. On the flip side, conditions like deep vein thrombosis can cause clotting in the leg veins, leading to noticeable swelling. So if you're constantly battling that "I wore my lucky socks today" look, it might be time to consult your doctor. They'll inquire about your symptoms, evaluate your medical history, and conduct the necessary tests. This could entail a simple check of your blood pressure or a scan to visualize your blood flow. Based on the findings, your doctor will collaborate with you to develop a personalized plan. This might include lifestyle adjustments such as elevating your legs, wearing compression stockings, or engaging in regular physical activity. In some cases, medication or other therapies might be recommended as well. Remember, while a little swelling might be an occasional visitor, persistent puffiness in your lower limbs is a signal that your body's circulation system needs some attention. Sign number 5, erectile dysfunction for the gents. If you're a man and facing issues down under, it's not just a late-night infomercial special. It could be your body waving a red flag about poor blood flow. That's right. Erectile dysfunction, or ED, often gets linked to circulation problems. When blood flow isn't optimal, it can affect the arteries and veins responsible for, down their business. Imagine your arteries as the delivery routes for essential nutrients and oxygen to reach the penile tissue. If these routes are clogged or narrowed due to poor circulation, it can hinder the penis's ability to rise to the occasion. Now, while occasional ED might be a result of stress, fatigue, or, having too much coke, consistent issues could point to something more serious. Conditions like heart disease or diabetes can wreak havoc on blood flow, making it harder for, you get the picture. Even smoking and obesity can play their own tricks on circulation, affecting the delicate balance needed for, that special function. So if you're facing persistent ED, don't just brush it off as part of the male experience. It's your body's way of sending out a distress signal. Schedule a chat with your doctor, lay all your cards on the table, and work together to address the issue. They'll consider your symptoms, delve into your medical history, and recommend the appropriate tests. This might involve checking your blood pressure, testing your blood sugar levels, or examining your arteries with an ultrasound. Based on the findings, your doctor will help you craft a plan that could include lifestyle changes like a healthier diet and regular exercise or medical interventions to boost circulation and manage underlying conditions. Remember, while occasional ED might be a common male woe, persistent issues are a signal that your body's blood flow system needs attention. Sign number 6, slow wound healing. Have you ever noticed how a paper cut on your finger seems to linger longer than usual? Or how that scraped knee takes its sweet time to heal? When your body's circulation isn't functioning at its best, wound healing can slow down. Why, you ask? Because your blood plays a vital role in delivering essential nutrients and oxygen to the healing tissues. Plus, it whisks away waste products, ensuring the area stays healthy and the healing process stays on track. Now, while small cuts and scrapes might seem like a minor inconvenience, slower healing times could signal a more serious issue like vascular disease. Imagine your arteries as bustling highways for your blood flow. If they're congested with plaque buildup or other roadblocks, it can hinder the delivery system, affecting how quickly your wounds heal. Plus, conditions like diabetes can also throw a wrench into the works, making it trickier for your body to mend and repair itself. So if you're noticing that your wounds are taking the scenic route to recovery, don't just wait it out. It's your body's way of raising a caution flag. It's time to contact your doctor. They'll investigate your symptoms, dig deeper into your medical background, and order the necessary tests. This might involve checking your blood pressure, examining your blood vessels, or scanning your arteries. Armed with the findings, your doctor will team up with you to create a personalized plan. This could include lifestyle tweaks like a balanced diet, regular exercise, or quitting smoking, depending on your needs. Your doctor might also recommend medical therapies or medications to improve blood flow and manage underlying conditions. Remember, while a slightly slower healing time might be an occasional hiccup, consistently slow wound healing is your body's way of indicating that the circulatory system needs attention. Have you experienced any of these signs? Let us know in the comments below. Don't forget to like and subscribe for more informative videos like this. And remember, knowledge is power. Stay curious and prioritize your health. We'll see you next time.